Dear friends, welcome on this special day, 8 March, International Women's Day. We are dedicating our discussion to women's health, recovery, and empowerment. Today, our guest is Mrs. Mayte from Neoviva, a renowned clinic in Switzerland that specializes for personal programs for women. And there are many concerns and questions about mental health recovery, personalized treatment approaches for women, and I have gathered mostly frequently asked questions. But before we start, dear Mrs. Mayte, could you please introduce yourself?
Most people know me as May for short. Thank you for having me. And yes, I'm a psychotherapist, and I'm also the lead of the clinical team at Neoviva here in Switzerland.
Oh, perfect. So let's start from first questions. What
Sure.
makes Neoviva Women's Program different from traditional addiction treatments?
That's a really good question. So our program is unique because what we've designed is to address the specific problems that women deal with.
Mm-hmm.
And most people aren't aware that actually women have different issues that they cope with in addiction compared to men. So even though men and women will experience addiction, the path to reaching the point where someone is addicted for a woman is quite different than it is for a man. And so our treatment doesn't just treat everybody the same, it actually tries to specifically treat those differences. So women are getting a program that is specifically designed and addressed for their issues and their needs. And those can be anything from social issues that women deal with, biological differences that they may not even know about, right? And psychological differences that women experience in compared to men. So we've designed it to be specific for the problems that women deal with.
Perfect. Why is trauma-informed care and hormonal rebalancing important in addiction recovery?
So those are two different things, but they're actually connected quite a lot. So it's really important because women actually, most of the women that come into addiction treatment centers have experienced some kind of trauma in their background. And so it's important that if we're going to offer psychotherapy services to our clients, that all of the modalities that we choose to use, whether it's CBT or whether it's psychodynamic psychotherapy, really are informed about trauma and are designed to address the trauma that people are coming with when it comes to therapy. So that's really, really important. And what was the second part? So it was trauma and
hormonal rebalance.
You were asking about hormonal, yeah. So hormones for women in particular are really, really important, especially if women are at a particular phase in their life where hormones start to change, for example, like during menopause or even perimenopause, women start to experience shifts in their hormones. And that can actually make them quite susceptible to developing an addiction. But also, let's say it's a woman who's in recovery and she's trying to stay away from using drugs or alcohol, for example, those shifts in hormones can make her more vulnerable to relapsing. So it's really important to address the psychological, which would be the trauma in the background, but also hormones if that's something that's influencing mental health. And we know that the two actually are related. They do influence each other.
Yeah. So how does genetic profiling help in creating personalized treatment plans?
So this is something we're actually considering to do. We're still working out how to use it, but it can be informative in the sense that when you get us a genetic profile of someone, it can actually give you markers that tell you whether you're susceptible to certain diseases, for example. So if things run in your family like diabetes or other health issues, genetic markers can actually tell them whether they really need to actually pay more attention to to this factor. So in addiction, it actually would be important because substance use can impact your physical health as well. So someone might actually want to know, how has substance use impacted me? And where do I need to really focus my recovery on? Not just the therapy, but also the physical health or any damage that the substance abuse may have caused.
Okay. Why is the program delivered in a co-ed environment, and how does it benefit women?
That's a really good question too. So a lot of programs are like women only or men only, and those are really good. There's nothing wrong with that. Actually, for some people, that would be the best environment. The way that we work at Neoviva is we have a real world setting. We really like to see ourselves as creating a setting that doesn't feel like a clinic, right? But is somewhat related to what people experience in real life. And real life means that you have to interact with other people from other genders. So we want to be very protective and we want to create a women's space. So part of our program does have that. But we also want to be able to help them in interacting with others. And so that means that there will be men around. But what we do have is a really good staff. We have women on our staff as well, and they're all trained and informed on different kinds of gender issues. And we have really good boundaries with our clients. So it's a safe environment, but it's a mixed gender environment.
Perfect. How do you ensure a safe and supportive space for female patients?
So that kind of touches on what I said just briefly. It's having very good staff, women and men on staff, but staff that are informed about women's issues, and also having really good boundaries, so having very good structure in the program and creating spaces for our clients to be able to tell us if there are any issues that we need to be aware of. So all of those things help us create a really safe space. We also have very low number within our groups. So we don't have like 20 people in a group. We're a boutique clinic, so we take up to 5, maybe 6 or 7 clients at once. So we keep the numbers really small, and that allows us to have almost the same number of employees and trainees as the number of clients that we have on site. So that lets us keep the environment very safe.
Perfect. What is gyne-psychiatry and why is it included in the program?
Yeah, so this is a term that describes a field that is gynecology and psychiatry. So it's a funny word when you hear it, gynecopsychiatry, right? But it's a mix of the two. It's essentially it's the connection between the expertise of gynecology, hormones and hormone profiling, and psychotherapy and psychiatry. So how hormones impact psychology and being able to address the two all in one.
Good. How do complementary therapies like yoga or equine-assisted therapy help in recovery?
Yeah, they actually help quite a lot. At Neoviva, we work with a few complementary therapies. So we have an equine therapist. This is a person who works with horses, and they are especially trained to actually pick up on emotional experiences of the clients. And that's a really great kind of complementary therapy because some clients, they don't do well in an office setting just talking. Talk therapy is very good, but for many people, it's very difficult to express emotions just through talking. So we can use equine therapy, for example, as another way to access the client's emotions and help them gain from the therapy without sitting in a traditional therapy space. So we're able to combine the two. We also use art therapy, for example, which is another way to express emotions without using words, right? And we also have a very special kind of practice called Shinrin Yoku. It's actually a Japanese form of mindful meditation, and it's done outside in the environment. So our clients go with our expert and they actually connect with the forest, they connect with the sounds, with the smells, and it's just another way to learn how to really ground yourself in the environment without using words. So when you combine traditional therapy with these kinds of therapies, you really create like a very comprehensive type of recovery environment for people. So we really love to expose our clients to all of these things to see what will benefit them the most.
Perfect. What role does family involvement play in treatment?
Yeah, so family can actually be very involved, or sometimes family is less involved. And for me, I think that depends on how supportive the family environment is. So I'm sure you know, some people come to treatment and they come from very supportive families.
Yeah.
They want to be very involved. They want to be in touch with the client. And for other people, the family environment is actually a really big source of stress, right? Or maybe some of the trauma has come from that environment. So for us, it's really important for us to understand the family and see if the communication is supportive, then actually it's really amazing to involve the family. And involvement could mean, you know, that they come and visit and we can arrange that if that helps the client stay motivated and stay connected to their family members. Or it might just be a phone call every day, you know. For us, we even offer for me to connect with the family and I can explain to them what their family member is engaging in through their treatment, how they're doing. So we can decide the level of involvement depending on, you know, what's best for the client. But it can be very involved or it can be not involved at all. It really depends on the client.
Okay. What does the 30-week post-treatment support package include?
Right. So we offer continuing care. So, and that's really, really important because when a client finishes their program with us, they go back to their everyday life, right? So the recovery process continues. It's not finished when they complete the treatment program. So we want to stay involved and help them transition back to normal life. So we offer continued sessions with their key therapist. So the therapist they were working with at Neoviva, they continue to work with them later. And we also involved recovery counselor check-in calls. So we have specialized recovery counselors at Neoviva. These are people who are in recovery themselves, but they've been in recovery for at least 10 years. So they're experts in recovery. They know what it's like to go through this. And they will call the clients regularly just to check in on them, see how they're doing, if they're having any issues, if they need to come back. So we do this for up to 7 months. And then the other thing that we have is we have a recovery group every Wednesday evening. And we do this online with clients that have left, but also with the clients that are still at Neoviva. So they can meet once a week. They can talk about what it was like to be in treatment. They can talk about what life is like when they leave. And it just allows them to connect with people that understand what they're going through. So we offer all of these things once they leave, so they don't feel like they've lost their connection with us, and they can keep working on their recovery once they're back home.
Okay. There are one similar question that how does follow-up psychotherapy help in preventing relapse?
Yeah, exactly. So it's psychotherapy and the check-in calls, right? They continue the work they're doing. So if there was trauma that they were dealing with, that keeps going once they leave. But then it also allows the therapist to deal with issues in the moment, right? So if a client is going back to a particularly difficult family situation and now they're back with their family, it's really important to keep doing the therapy, right? Because now they're back to life. So they have to sort of relearn how to live in this new way, right? In this new space. So that's really important that they keep doing the work they do. And with the recovery counselors, it's even more important because these are people that know what it's like to go back and deal with a difficult marriage, right? Or a difficult work situation, or you know, the social settings when they go back to see their friends and their friends want to go out to drink, but they're in recovery. these are the people that will know how to help them deal with these kinds of situations without completely cutting everybody out of their life, for example. So it's incredibly important that they keep doing this once they leave.
Okay. What are the biggest challenges women face in addiction recovery?
Well, there's a lot. I mean, one of the biggest ones is, I think, the expectations that are put on women from society, and that could be based on their cultural background. It could be based on the country they come from, but it can even be based on the family culture as well, right? And especially women that maybe have a lot of responsibilities, or mothers have quite a hard time dealing with this because there's just a lot of stigma, right? And a lot of shame when moms in particular are having to ask for help. Maybe the fear of being judged is really difficult to cope with. So the societal shame and the societal expectations, I think, are probably the biggest. Outside of just being abstinent and dealing with the addiction itself, I think it's the social expectations, and then also just the consequences that women have to deal with when maybe they share that they're having problems with drugs and alcohol, how people are going to treat them, or if they have children, what will happen to their family if now everyone knows that they're in recovery. Those, I think, are quite big issues that women have to deal with. I'm not saying men don't have to deal with that, but it's just a different experience.
How does the program address biological differences in women's addiction and recovery?
So that's through the hormonal testing that we will actually offer, and through the health checks that we offer. So we will be looking at the results of some blood work that we will offer, and we'll see whether there are any nutritional deficiencies, whether there are any health problems that need to be addressed, and if there are hormonal imbalances, specifically in women. This is where the unique biology of women comes in place, especially with hormones, and we can help create a plan to actually treat that while they're in our program.
Okay. Why is peer support so important in the recovery process?
Yeah, so peer support is really, really important, because often what happens in addiction is people become very isolated. You know, that's what is it.
Yes.
You got cut off.
Now I hear you.
Okay. Should we do that question again?
Yes, last question. Why is peer support so important?
So it's really important because when people are dealing with addiction, their social circles get very small. Either they get cut off from their family or their friends, or they lose their job. And the worse the addiction gets, the more isolated people get. So treatment really has to include peer support. So part of that in our program is the recovery counselors, but it's also a group treatment. It's not just individual treatment. So they will meet other people that are also in treatment. They will be able to connect with them, and they will be able to continue connecting with them once they leave. That way we can start helping them build their social circle again and prevent the isolation that happens during addiction.
Okay, these all questions, and thank you, Mayte, for sharing these valuable insights and for your dedication to helping women recover and thrive. And to all women watching this video, remember, you are strong, you are capable, and you deserve life of health and happiness. And if you still have any questions about Neoviva Women's Program, just feel free to email us or leave message on WhatsApp. We are here to support you on your health journey. Thank you again and see you in next sessions.